Hi, my name is Jasmine Acosta-Madlambayan, and I am going to talk about hearing loss for professionals who are primarily in the dentistry industry. And this comes from me doing a lot of different research and work with dental hygiene students. And I noticed that while I was in the clinic, there was a lot of really high pitched noises that were pretty loud that even for me would make me go oof. And I couldn't imagine being someone who loves their job, loves to be a dentist, or loves to be a hygiene specialist, and has to hear that all day long without knowing the impact it could have on their hearing. A biggest thing that I would say is to check how loud it actually is. Check how loud it is in your surroundings using one of the apps that can calculate, the decibels and just how high pitched those frequencies actually are, knowing that these things can affect your hearing. Understanding that there are many different ways for you to protect your hearing and protect the hearing of your individuals and the patients that are in your office by saying, please wear, protective coverings over your ears, or wear some sort of earbud to just dampen the noise a little bit to protect, that cochlea and those tiny little hair cells that are in your ear that do so much for you. Another thing is that if you do present with, high-pitched ringing when it's quiet, or you're noticing that you do have some pain or difficulty hearing and some pain in that ear, that there is something that you can do. You can go and see an audiologist or an ENT, and they can do a full hearing evaluation on you and possibly give you a diagnosis of a hearing difference. If they give you a diagnosis of a hearing difference, they then will tell you what severity it's at and say it is mild to moderate. Well, mild to moderate means that you are still missing speech sounds, that you still can't hear certain things. It's going to be difficult for you to possibly be able to hear the individuals that you're working on. And if that is the case, there's plenty technologies that are out there to help you. Say that they fitted you for a hearing aid, and personally, I don't find a stigma with hearing aids. I say do a bigger hearing aid with a bigger battery, longer, lifetime, and take care of them. And if you can, making sure that you're just checking them every day, that you're checking that your hearing aid is working, that you're double checking that your mold doesn't have any moisture or anything that could affect your hearing aid in it, and checking to make sure that all of the debris and the wax is cleared out of it so that your hearing aid is functioning properly. If you have a hearing aid and that you are working in those high-pitched sounds, it is nice that you could still take out that hearing aid and put coverings over them, or you could try to use some sort of speakerphone over your ears that dampens the noise from the outside but has a microphone so that you can speak to your patient. I know that some dentistries use that, and I think that's pretty neat. Aside from that, just knowing that having those high intensity volumes and high decibel volumes for long periods of time will eventually hurt your hearing, and it is best to start taking precautions now.